Good afternoon, everyone. See all the attendees coming in right now. Delighted that you could join us for this webinar this afternoon. Healthcare Comms and the COVID Challenge, Myths, Disinformation and Anti-Vaxxers. Delighted to be joined today by Sarah Roberts. Hi, Sarah. She's Head of Digital Communications at Cambridge University Hospitals NHS Foundation Trust. And Orna Young, who's joining us from Northern Ireland. Orna is the Director and Co-Founder of FactCheck NI. Good morning, afternoon, Orna.
Hi.
Hi. So I'm going to quickly introduce us and take you through a few slides. Hopefully everyone will be able to see my screen there. So if you'd like to join in the conversation today, please do use the chat or question function. We do have time for a Q&A at the end, and we'd like as many questions as possible coming in. You can also join the conversation on your social channel of choice using the hashtag COVID Challenge WBN. That's all that information again. So this is a slide I've stolen off our sister brand Pulsar, the audience intelligence and social listening organization, who at the very beginning of lockdown did some analysis into anti-vaxxers and the conversation that anti-vaxxers were having online. And as we can see here, it's been quite a rise in recent years, but this is not a new story. The anti-vax conversation has been going on for a long time, but as we hit the COVID lockdown in March, the conversation grew massively. So it actually grew by 5 times in both terms of volume of posts, but also engagement. So this is obviously a huge issue that we're experiencing today and something that we will be covering in the webinar. And also another interesting element I wanted to take off Pulsar was to look at the different topics that were being discussed by the anti-vaxxers and to show how the conversation has changed pre and post COVID. So whereas vaccine injury was one of the biggest topics of conversation before COVID came in, the conversation has shifted greatly into big pharma and mandatory vaccines taking the share of attention as whatever fears these people have are focused around the vaccinations for coronavirus, which we hope will come soon. So that's it from me. I'm going to stop sharing and I'm going to ask Orna to take over, and Orna is going to take us through the current situation. Orna.
Thank you, Jake. I'm hoping everyone can see that screen okay. If I get a nod or a scream or hear a scream, it should be fine. Guys, my name is Orna Young. I'm the Executive Director of FactCheck NI. We are Northern Ireland's first and only fact-checking organisation. We were founded in 2015, and I guess we depart from the traditional fact-checking organisation model in that we fact-check and we deliver articles and put information out there, but we also deliver training, particularly around areas of critical thinking and community groups, schools, basically whoever wants to learn more about fact-checking skills. So you can get us there. Oh, this is not, hang on a second. Yes, there we go. So I suppose best to start with, I suppose, where we're at today and what brought us around to fact-checking in Northern Ireland in an area that really hadn't presented with it. The fact that we're living through a global health emergency and that information has, to date has never meant such a life or death situation, and it has been coined and termed an infodemic. Never before has the quality and accuracy of information mattered so much, and we've certainly seen that in our work in the last 6 months. I'm sure when we started in 2015, we never thought we'd see what we're living through in terms of just never mind on a personal level, but indeed at the level of being a fact checker. So we look at it as an information disorder in terms of what's been happening and what we're seeing a concentration of, particularly in recent months in relation to health and health information. So there's 3 types effectively. So you've misinformation, which can be, in my case, probably an aunt or uncle or somebody on Facebook accidentally sharing information that's wrong. It can be shared, usually unintentional. They basically don't realize it's not true. And I am the worst friend to have on Facebook if that's the case. In terms of disinformation, then we know that this is intentional. It's put out, often conspiracy rumors, things like that. And I'll show you in a little while some of the things we've seen in relation to Cobot and malinformation. This is kind of a larger scale in terms of misinformation. and is used to inflict harm on an individual or indeed an organisation or a country. So you can see the three types there, and this is what we're dealing with. Now, what we say to people when we're talking about misinformation, particularly, and disinformation, is that there's questions you can ask yourself. We are happy for people to fact check. We don't see this as an elitist role for ourselves. We see this as something that we want everyone to engage with, hence our model of training people in these skills. So while we think that, basically social media platforms, and we are members of the Facebook for third-party fact-checking program, we think that they have a role to play in the nature of the information that's being propagated on their sites. There's no doubt in that, and removing this and disinformation. But there's also a responsibility at the level of the individual to check what you're sharing. And that comes back down to our think, check, share, is how we always put it. So we always say to people, if you don't know the source, check out about the page. Simply go in and have a look around. What is it, the things they're sharing? We're all, as human beings, fundamentally, I suppose, predisposed to, believing what we read. So go beyond that. Why are they sharing the story? Is there an agenda? We often say that one extra click can help you spot fake news or misinformation. Read around the story, check what's been discussed around it, and look for the images, look for the data, any quotes and who they've been attributed to, and you can see what basically is missing from there. Fundamentally, I think as well, particularly in relation to COVID-19, is how is it making you feel? And I'll show some examples of that in a minute. The people who are trying to make this news are trying to manipulate your feelings effectively. They want you to feel anger, or they want you to feel scared or anxious or shocked. And because that really results in you probably being more likely to share it. And I think that's key here. We all have visceral reactions to things we're seeing online at the moment, whether it be political quotations or data about, graphs being taken out of context. All these things are asking yourself these three questions can be really, really, really helpful in this context. So we often get asked, and in fact, I probably should get an award for how many times I've been asked this, who checks the fact checkers? We are FactCheck and I, and as are Full Fact in GB, members of the International Fact-Checking Network. And this basically means that we have to adhere to certain principles. So when people, and we do, we get this on our feeds as well, or people are saying, well, what gives you the right to say that, you fact-checkers are right on this? And we don't always get it right. And when we don't, we're very transparent on that. So what we've shown is that we have a commitment to non-partisanship and fairness, transparency of our sources, so everything you can click into, anything we're quoting, you can go and check out for yourself. Crucially, a transparency of funding an organisation, and that's key for us, because particularly in the Northern Ireland context, that can be seen as a particularly polemic. A transparency of our methodology, and as I said, open and honest corrections. As human beings, as I said, we don't always get it right. What's key as well is that there are other sources. This is a global effort in terms of misinformation, folks. The Poynter Institute in the States has been coordinating hashtag Coronavirus Facts Alliance, and basically this has resulted in that what we contribute into is about 7,000 fact checks around COVID-19 from 70 countries in over 40 languages. So there's a lot of information out there. If people want to look for it, they can find it. And I think that these initiatives like this are really helpful in that they show, I suppose, a concerted global effort, because as Northern Ireland can particularly tell you, COVID does not stop at a border. So what we worked on through, I suppose, as I call it, banana bread lockdown, would be the COVID-19 Information Dissemination Project. And this was a partnership between ourselves, FactCheck and I, and the Community Development and Health Network in Northern Ireland. Now, the Community Development and Health Network have about 2,500 community members. They're involved in community development on grassroots level in terms of that, and they're basically helping those kind of more marginalised in a lot of senses, or unreachable in effect with relation to, they're very much focused on building health equality. So when we met with them and we spoke with them, we realised that we wanted to, kind of disseminate information about COVID-19 and unpack that because some of it can be really, really tricky and almost opaque actually at times. We also wanted to fact check unofficial information about COVID-19. We were finding this in Facebook groups, Twitter, WhatsApp groups. A lot of this information was coming out through them, and we were able to identify that online and deal with it accordingly. We also wanted to counteract any gaps in information or misunderstandings about COVID-19 and the response to it. And they went and taught us a lot of FactCheck and I in terms of the health literacy approach that they had. And it has really, I suppose, informed and been really, really a moment for us in terms of as an organisation and how we communicate. And also we were to prioritise the role of dissemination about information of role of pharmacies. Now this is key, folks, because peak, some of the areas that they're working in, people just weren't able to access the information they needed. So just to give you a sense of what we were dealing with, kind of at the start. So this was one of the first ones we did with it. And I think it's a good example because it just shows the fear. And I've given the example of where the claim came from, but we fact-checked this with the Community Development and Health Network because people were very, very afraid. In fact, I'd heard from quite high levels that this was presumed to be the case. So there's one of Northern Ireland, that might be its only ice rink. Basically, there was a rumour going around and started on Facebook, and basically it said that they're going to use it as a morgue. And this was, coming from top, quite high levels. So when we went in and fact-checked it, we realised actually that wasn't the case. And we disseminated that not only through our own networks of FactCheck and I, but also through that of CDHN in terms of their grassroots outreach. And this went viral as well. We had quite high level politicians and individuals with a lot of followers and a lot of reach, retweeting this and sharing it to their networks in a bid of that fear. So in terms of fact-checking, it was shown to us that actually kind of distilling down very normal day-to-day worries that people have in relation to COVID-19, which is the fact that, important and how we frame that in terms of language and accessibility. One recent one that we've had, and this is another good example of fact-checking kind of taking you places where you didn't expect to go effectively. We had spotted this claim regarding that there'd been a comparison, a very quite ghoulish comparison going on online in discussions about rates of death by suicide in Northern Ireland versus that of death from COVID-19 or attributed to COVID-19. And you can see from this that we've distilled down the actual data into very, very accessible, quite, I would say, stark in that, people need to be able to find the information very quite quickly in an accessible manner. And what we found when we fact-checked that is actually that rumour, that misinformation, that disinformation actually had travelled from Galway to Dublin. So there was a Galway version of 33, and it was Dublin. So our colleagues in the journal.ie, which is a fact-checking organisation in the Republic of Ireland, had found that, and then it made its way to Northern Ireland, by which time it had then morphed into 33 people died by suicide in Belfast. So I suppose this kind of reveals what's at stake. It's not necessarily just the purist, and we do deal a lot of that in kind of, our explainers is a lot of the work we did with DHN through the peak of lockdown, was explaining how, for example, deaths from COVID are quantified. We translated a lot of the government information, which I'm sure Sarah will be able to tell you a lot more about in terms of her work, but we spent a lot of time kind of just distilling that information. But what we're finding is the stuff that we found, I suppose, most far-reaching was actually the stuff that kind of, as I said, evoked that sense of fear or anxiety in people, and especially kind of resulting in the biggest emotional reaction. So that of morgue in a ice rink, death by suicide. So what we've realised actually in a lot of senses is that the information that we're fact-checking, people just want the story. They want the story distilled. And I think going forward, we're really committed to that idea of health literacy and applying that across our work in relation to COVID-19. But we also see this as a global effort. And that's why, as I said earlier, we were working on the COVID Facts Alliance, because we can't do this alone. We've been working much more closely with for example, liaising with colleagues in the Republic and indeed in GB. And to that end, I suppose, it only going forward in terms of vaccinations and things like that, we recognise that this is going to be a challenge in terms of, I suppose, dealing with people's expectations in terms of the information that they're accessing. Thank you.
Brilliant, Orna. That was a fantastic amount of information in a short space of time, and I think it's a real call to action that we all have a responsibility to ensure that we're asking those questions to make sure that we're not spreading disinformation, misinformation at that point, I guess. So yeah, that's brilliant. We're going to now hear from Sarah, who's on the front line of health comms and tackling, I guess, very specific COVID-related issues, Sarah. And don't forget, you can use the Q&A function at the bottom of your screen to ask questions, which we'll get to after Sarah's talk.
Excellent. So hopefully everyone can see this. So I'm Sarah and I'm Head of Digital Communications at Cambridge University Hospitals. So I think what Orna was describing is really interesting in the context of the NHS, because a lot of how people think, how they feel and how they act has direct consequences upon how they interact with the NHS, and potentially put themselves at more risk of getting COVID, of getting these diseases which are spreading via pandemic. So it does have direct consequences. But a bit about me, I have more than decades experience in public sector comms and marketing. What I really care about is ensuring our patients have a great digital experience at our hospitals, and I'm currently leading a team of 5 brilliant digital comms people through probably what is arguably a very tricky period through NHS history. I won't dwell too much on this, as Orna has articulated this very well, but I think it's very important to understand the distinction between it. So disinformation, that deliberate creation, versus misinformation, the people who are actively consuming this content and perhaps not checking as much as maybe they ought to. But it all impacts upon the NHS and our ability to respond. And it is one of the biggest challenges for healthcare communicators because of those the implications that the NHS might have because of people following what is misinformation. But it's not new. So we know that from the Spanish flu from 1918, it's called the Spanish flu because no other countries were prepared to admit that it was affecting their population because they were at war, which would have been obviously not a good position for them to be in. So disinformation is not new, hence the Spanish flu. So sorry, Spain, about that. But what has changed is that speed and the volume that disinformation spreads, which, as Orna has also said about the infodemic that the World Health Organization has coined. We also have misleading statements from politicians. So we look to them to provide us with the information, a source of truth. So when we have people like Trump who are ridiculing Biden for not wearing face masks, which is one of the safety measures, which is incredibly important for people to be following in those certain situations that are dictated by the regulations, that can have impact on how the NHS responds. But also we are approaching winter, which historically flu season, we also get spouts of norovirus as well. So there are periods of time which can be very tricky anyway. We get people coming into the system who are often very sick and sicker than people who come in the summer months and stay for a bit longer. So that combined with the COVID has the potential to be really challenging for the NHS going forward. So the implication of misinformation and disinformation does affect its ability to respond. So you'll recognise these scenes from the weekends, the We Do Not Consent marches, and this is becoming increasingly on the social narrative of how people are responding to, I suppose, the regulations that are still in place, and they've been in place obviously for a while. But what people, I suppose, are not understanding is how it's impacting on their lives, because often it's not. People who might not have had anybody who's been touched with coronavirus, so they can't see how it's affecting other people. However, when we have our nurses and our doctors who, through that period of time in the first peak, they were living and breathing it every day, and trying to communicate and translate that into action that the public can understand the reasons why we need to keep active with these measures is really important. And we also have influencers as well. This is Famke Louise from the Netherlands, who she posted on Instagram, "Only together can we regain control of the government. I no longer participate. Free the people." She faced quite a big backlash on this and has since deleted that post, but also she has asked to be educated by virologists who can help her understand the pandemic a little bit better. And I think what she probably didn't realise is the effect of her platform and how influential as an influencer she is in the ability to affect people's behaviour. So from an NHS perspective, I think I want to touch on 3 key principles rather than looking at specific tactics of what we're doing. So when we're communicating, it's really important to keep our NHS staff front and centre, because this is affecting their day-to-day jobs as they're working in the NHS. It's that credibility factor, and it comes back to trust. So having people like your Giles and your Moras of the world helping to explain, well, what is happening? Why are we doing the things that we need to do, particularly from a hospital perspective? It's really important to have that to fall against, because we believe people, and that's really important in getting that message across. And likewise with giving experts a voice and becoming a source of truth for people to rely on. As Orna has explained, you know, the reactions to this, the disinformation is designed to create reactions. So what we need to be on our platforms is that source of truth, that source of reasoning. So giving experts a voice is one way to do that. So this was a Medicine for Members lecture, which usually would be face-to-face, but was done via Zoom. And what it did was hear from some of the experts who were delivering care across the hospitals and the wider community. So it included some GPs as well. And what that did was enable our community to understand, well, how was COVID affecting the hospitals? And that was really important. And also amplifying government messaging where it makes sense, because we know it takes between 5 to 8 times for people to understand a message. So having it coming from multiple sources, the right information, that can have a positive impact too. So what are others doing? I really like what the World Health Organization is doing on TikTok, trying to reach younger audiences. Though I wouldn't class myself as a younger audience now. It's one of my favourite platforms. And it encourages people to report false information should they see it, to help that global effort of mis and disinformation. We also have the government, who is actively paying influencers. They've had some pushback on this from the Advertising Standards Agency, because I think the first few that happened didn't make the standards that they'd expect. So since then, there hasn't been as much pushback. But what that is doing is helping to get the government messaging across in a really authentic way. So they're not just spouting what the government is saying, they're taking it, knowing who their audiences are, and tailoring it in a way that makes sense for them. So applied in the right way could be quite powerful. And finally, I'd like to finish on my local, it's a Facebook group that was set up called Essex Coronavirus Action, and they're quite bold and brazen with their messaging. I really like what they've been up to, helping to again get those key messages out, and also challenge a lot of the mis and disinformation that's circulating, and in particular capitalising on the popularity of Tiger King. So I'll finish with Carol Baskin, if I may.
Hey all you cool cats and kittens, it's Carol Baskin at Big Cat Rescue. I just wanted to remind you that when you're in Essex, that you're not just wearing a mask to protect your own health. You're doing it for everyone else's too.
And here's a few resources that I think are really worth a look. In particular, the Resist Counter Disinformation Toolkit that's provided by government. It takes strategy and turns it into action. So thank you very much for allowing me to share that with you.
That's brilliant, Sarah. Thank you. If you just leave those resources there, then...
oh, okay. Yeah.
Sorry, I guess our audience can make use of those and take notes if needs be. Sarah, I'm going to ask you the first question. How much of your communications is working with other NHS trusts or working with other, I guess, healthcare communicators, maybe across charities or the pharmaceuticals industry? Is there any coordination in that sense about making sure you're all on message?
In terms of that coordination, I wouldn't say there's that greater coordination. We are very supportive of partners who provide us with campaigns, and we will actively support them to make sure that those messages are shared with our audiences, because as I say, the source of truth on platforms, there could be more to be done on that to coordinate it in a way that makes sense, but we do actively work with partners to help share their messaging with our audiences.
Excellent. Orna, we've got a question here specifically about the IFCN. Can any company that does research be registered with the IFCN?
No, it's only basically it's like a quality assurance for fact-checking organization, but anybody can go on the IFCN or Pointer website and check out that fact-checking COVID alliance. So that information is available readily. You can check out those 7,000, and they have some brilliant dashboards and infographics on there, kind of, and you can search by region, by topic, specific within COVID. So it's an organisation that's completely fact-checking focused or organisation focused, and that we have to meet certain standards to be verified by them. But any organisation or any individual, anybody can go on and check out what work and research they're doing. They do a lot, not just with COVID, but just around the area of fact-checking. They're fantastic, and they kind of help us in terms of our coordination on the issue on a global scale, not just on UK, Ireland. So yeah, it's been really helpful.
Excellent. And a question from me. Are you seeing that, because we often talk about like echo chambers on social media and people only hearing like certain things that they want to hear. Do you think that's indicative of what people want anyway? Was it like that before social media? They were more likely to read certain magazines or newspapers. They were less likely to be challenged anyway. It's just that now I guess that accessibility to it is so permanent that it's more extreme.
It's a funny one because there's been so much research done on this, and I think it's human nature to self-select into particular bubbles, right? Any one of us can go on our Twitter feed and see everything we want to hear and everything we want to say on any given day. But this is human nature. I think we want to see what we believe in reflected in what we're consuming, and that's why even when I was a student, sometimes I would purposely go on, this maybe says more about me, but I'd go on and read something that would really challenge me. The thing with fact-checking, though, it's not about challenging for challenging's sake. We are there just to find the raw, basic answers and facts in that. In terms of echo chambers, the challenge for us is ensuring our message, which isn't about taking sides on particular topics, it's just about putting out the raw facts, is permeating those things. So, why we set up a partnership with, for example, the Community Development Health Network was that we knew we would be able to get in the grassroots thing. The irony being that, okay, WhatsApp groups have been more different, have really come into their own. I know in the Republic of Ireland, there's a big, huge effort by the journal.ie to access those and try and push the accurate information out through those. But the irony being is that Twitter's a very small bubble. We think the world goes on there, and Facebook too. Or as my cousin tells me, it's only mums are on Facebook now. So there's all the challenges are there. We're kind of rolling with the punches in a sense. But I suppose for us, what we want to do is we want to navigate that. We're not taking a side. We're just there to. And we will always be challenged. As fact checkers, we're constantly being challenged, which is fine. But once you have the information, the data, and the supporting evidence, then that you can only fall back on the quality of your work. There's no doubt about it. But the fact that we are a transparent, independent fact-checking organisation means that we can permeate them at a certain level if we have the right partnerships. And I think that's been a really good approach, and that's been something we've really learned from over the course of the last 6 months.
Excellent. Had quite a long question in here, but it starts by thanking you both for the excellent presentations, so that's nice. Sarah, I think it's probably more focused on you. It says, I work with FIP, the International Pharmaceutical Federation, representing over 4 million pharmacists around the world. Community pharmacies have remained open throughout lockdowns and have provided evidence-based advice and information to the community. How much and in what ways have you considered this role of pharmacies in your organisation's work?
Well, pharmacies do have a massive role to play, and in fact they, I suppose from a winter perspective, they are one of the ways in which we channel people to receive the advice and information. And I suppose in a way that they have a contact with people that often is a bit more regular than it would be for coming into a hospital per se. So pharmacies do have a really big role in helping to tackle this. So it would be interesting to think, well, how could that role potentially help fight disinformation and provide the right information that people believe might be wrong? So how is that reinforcing I suppose the NHS system from a UK an England perspective? How is that helping to help manage patients and encourage the behaviours that we do want to see, so that they don't inadvertently end up I suppose becoming a burden on the system? So I think that's a really interesting way to view pharmacists and their role. I hadn't thought of that before, but that is really interesting.
Excellent. I guess, Orna, maybe you could comment on that too, but like the idea that the fact-checking that you're doing online could then carry through into, I guess, real-life situations and, in-person communications, that obviously it's harder to see how that misinformation or disinformation is spreading in person or outside of the internet. Is that something that you consider or can work with?
Oh, absolutely. I have a joke with some of our other colleagues that, I have my hairdresser test, that, my hairdresser tells me what's been said. So we've obviously the 5G, kind of conspiracy theories. That's a big one. And I think if we're not dealing with the stuff that's been talked about in a hairdresser's chair, or indeed, in a WhatsApp group with the family. And I come from a quite large family, so I can see some of that stuff that is coming out. And I think it's really important that you're actually meeting people where they're at. There's no point us fact-checking data that is not translatable, or fact-checking some aspect of COVID-19, or the lived reality for people is that people want to know how they can socialise. So messaging that, and us translating that for people has meant that we kind of tailored our work in a lot of ways to a lot of infographics, for example, which might seem really, really simple and overly simplistic. But when you're used to fact-checking in such a rigorous way, to distill that down to such a level, it has been challenging for us. We've had a lot of learning over the last 6 months. So I think absolutely you need to be meeting. And I see another message that's just come through their question there, and I hope I'm not
you go for it. Here,
but it's around managing the public communications on COVID rules. And I can only speak from obviously I'm not in the government comms team, and I can't tell you why they're doing that, but I can tell you as a fact checker and as an organisation, for Sarah can too, is that none of us have ever lived through a pandemic before, and we've never had to message it. We've never had to deal with something that's so profoundly impacting everybody. So I can understand at a very human level why it's difficult to message it, particularly when we're reacting, given that we're coming into the autumn, winter months now, it's changed people's expectations. I read this article during the week, and it's kind of surge fatigue or something, that, people are, their adrenaline's running low,
Yeah.
So I get all that, and as fact checkers, we have to be, and I'm sure Sarah will agree with me, in a lot of different sense, so we have to be very mindful of the fact that we're fact checking and we're delivering messages to actual human beings. I often test things out in my siblings because, I know how things land in that sense when I do that. So, it's human nature we're dealing with. We need to be really cognizant of the human beings at the end of our messages,
Perfect. Someone's commented that infographics are very helpful, so do keep them coming, I think. And Orna, do you partner with other organisations to check facts or get data?
We are fantastically fortunate. The Director of Research for the Northern Ireland Statistics and Research Agency is actually one of our directors. So we have, the expertise is tip-top, and we've, access to not only the accurate information, but also an understanding of how that information has been collated and why it's been collected in such a way. For example, a really good example is the difference in Northern Ireland between how NISRA, that particular organisation, collects data around death from COVID, and that of the Public Health Agency. So there's a difference between those two. So we've been, I obviously have a research background, but that level, it requires definite expertise to be able to. So we've been very fortunate in that way.
Excellent, brilliant. And time for just one quick question, Sarah. It's from me. Is this a battle that we're going to win? Is this something that we can keep fighting and keep the truth flowing?
People will always make things up, and people will always believe that, because sometimes they don't ask the questions to see whether or not it's truthful, because sometimes, as Orna has explained, it's a gut reaction that's designed to create that emotional reaction in you. So I'd like to think that we can help influence it, but I don't think it's a battle that you can win completely, because there will always be people, new channels will pop up, and so will disinformation on that channel. So I think it's a conscious effort to be thinking, well, how can your organisation do that in a more strategic and sustained way?
Brilliant. Perfect. We've run over time. I appreciate everyone staying on, and we've had a couple of questions we couldn't get around to, but we will try and get those answered for you separately. But for now, I'd just like to thank both our guests, Sarah and Orna. Thank you so much for joining us this afternoon.
Thank you. Thank you for having me.
And for everyone listening, we look forward to seeing you next time. Thank you very much. Goodbye.